My name is Shantrey Moore. I'm with the University of Texas at Rio Grande Valley in the Postmaster's Psych Mental Health Nurse Practitioner Program. The title of my assignment is The Influence of Art Therapy in Mental Health. Art Therapy, Uncovering Depression. And these are examples of masks of depression coming off. Historical and key figures. The term art therapy was conceived in 1942 by British artist Adrian Hill. Margaret Numberg was an educator and therapist. Margaret Numberg is considered to be one of the first pioneers to define art therapy as a distinct component of psychotherapy in the 1940s. To many, she was considered as the founder of art therapy. Adrian Hill had tuberculosis, and during his recovery, he identified the healthful benefits of painting and drawing. Art therapy is a therapeutic technique deeply rooted that creative expression promotes healing and mental well-being. The American Art Therapy Association believes that art therapy is an approach to mental health that utilizes the process of creating art to improve mental, physical, and emotional wellness. It is a method used of meaning through methods such as drawing, coloring, painting, and sculpting to construct and communicate feelings, thoughts, as well as memories. Some of the benefits of art therapy. The main goal of art therapy is to enhance an individual's personal sense of well being by allowing exploration into creative development. Art therapy also grants a person chances to analyze their feelings, deal with their emotional conflicts, build self awareness, and increase self esteem, reduce stress and anxiety, utilizes metaphors and symbolisms to help with personal expressions, make choices to gain a sense of control in unpleasant situations and environments, express and begin to work through issues surrounding hospitalization, diagnoses, and symptoms. And if you look next to this slide, there are also some additional benefits of art therapy. For the first time, according to the DSM-5 criteria for major depression disorder, 5 or more of the following symptoms have been present during the same 2-week period, and they must represent a change from previous functioning. At least one of the symptoms is either depressed mood or loss of interest or pleasure. Note: do not include symptoms that are clearly attributable to another medical condition. Depressed mood most of the day, nearly every day, as indicated by either subjective report. Sad, empathy, sad, empty, hopeless, or observations made by others. Examples: patient may appear tearful. In children, their mood may be irritable. 2. Markedly diminished interest or pleasure in all or almost all activities most of the day or nearly every day, as indicated by either subjective account or observation. Number 3. Significant weight loss when not dieting or weight gain, a change or more of 5% of body weight in a month, or a decrease or increase in appetite nearly every day. Note: in children, consider a failure to make expected weight gain. People may also present with insomnia or hypersomnia nearly every day, psychomotor agitation or retardation nearly every day. It can be made by observations of others, not merely subjective. Feelings of restlessness or being slowed down, fatigue or loss of energy nearly every day. Feelings of worthlessness or excessive inappropriate guilt, which may be delusional every day. Diminished ability to think or concentrate or indecisiveness nearly every day either by subjective account or as observed by others. Recurrent thoughts of death, not just fear of dying, recurrent suicidal ideations without a specific plan or a suicide attempt or a specific plan for committing suicide. The symptom cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The episode is not attributable to the physiological effects of a substance or another condition. Christine's assessment and diagnosis. Christine has symptoms including many of the DSM-5 criteria for an Axis 1 diagnosis of major depressive episode, aside from weight change and psychomotor agitation. Axis 2 consists of personality disorders and developmental disorders. Christine's symptoms do not fall into the category or criteria for an Axis 2 diagnosis. Axis 3 entails physical conditions that can encourage the symptoms of Axis 1. Christine has been routinely seen by her primary physician and has no illnesses that would fit the paradigm for an Axis 3 diagnosis. Axis 4 discusses the severity of psychosocial issues. Under this diagnostic section, a discussion is made regarding problems with primary support groups, educational issues, social environment problems, occupational problems, housing problems, economic problems, and legal issues. Christine has issues with her support system comprising of a recent divorce. Living arrangements seem to be a primary complaint. Educational stress from college, social environment, inadequate social support, not satisfied with her job, and inadequate financial resources. Axis 5 keys in on the level of functioning at its highest during the past year and currently where it is on a social on a scale of 0 to 100, with 100 being superior functioning. Christine presents with a current rating of 25, as she is functioning by going to work and attending class, but also having suicidal ideations and performance issues. Her functioning has dwindled from a high of 80, where she was having minor symptoms of depression, but was not having functional issues related to it. Treatment plan. Based on Christine's symptoms, she meets the criterion for DSM-5 major depression disorder. She was enrolled in a comprehensive 8-week outpatient program. Her regimen includes Lexapro 10 milligrams a day and 16 cognitive behavioral therapy during her 8-week program. Her MRI has uncovered a typical pattern of structural aberrancies in the brains of people diagnosed with depression and social anxiety. They focused on the thickness of the cortex, which is the outer layer of the cerebrum, or principal part of the brain. Her MRI found disorder-specific involvement in areas of the brain, the fear circuitry, which is associated with patients diagnosed and involvement of the visual recognition network in patients with MDD. These changes in the brain within the region of the visual recognition network could have some relation to impaired selective attention and working memory in major depression disorder. Considering the severity of her depression, the multidisciplinary team decided, in addition to medication and cognitive behavioral therapy, she will benefit from a nonverbal therapy such as art therapy. Christine wants to get better. She ambitiously agreed to participate in art sessions while in her program. The psych mental health nurse practitioner explained to Christine that art therapy is a therapeutic process to help facilitate emotional regulation and to help enhance her coping mechanisms, which will heighten her art therapy, mask making exercise. The benefits of applying art therapy into practice includes conveying your feelings in a tangible way and gaining discernment into your own psychological state, releasing painful emotions in a creative and productive manner, Becoming cognizant of your feelings that you were unaware you had and exposing obstacles to healing. Using your artistic production as a canvas for conversation and connection. Feelings of being understood and validated by both your therapist, your peers, expanding your ability to communicate. Increased level of confidence, imagination, and concentration abilities as you delve into your creative potential and give form to your emotional state. According to Bridges to Recovery, the benefits of art therapy include a biochemical component as well. When we view art, our brains release dopamine, the same chemical that is released when people fall in love, creating feelings of wellness, happiness, and pleasure. Engaging with art engages the innate healing abilities in your brain, giving you the opportunity to experience a sense of well being even as you explore distressing topics. As such, art therapy can be especially useful for those who do not feel comfortable fully engaging in traditional psychotherapy. In 2018, a randomized controlled study was done to show the effects of art therapy when used as an adjunctive treatment in depression among elderly women. The study was single blinded with elderly women diagnosed with major depressive disorder. All the women in the study were managed well on pharmacotherapy. They were ordered to attend 20 weekly art therapy sessions, which are all 90 minutes per session. The women were evaluated after 20 weeks using three scales: the Beck Depression Inventory, the Geriatric Depression Scale, and the Beck Anxiety Inventory, and cognitive measures. Logistic regression analysis was adjusted for age, revealed that women in e.g. N equals 31 had significant improvement in GDS, P equals 0.007, BDI, and BAI scores compared with controls. In summation, excluding a few limitations, the study art therapy significantly improved the depressive symptoms in elderly women. In 2014, cancer patients are seeking out alternative and complementary options, including art therapy, to deal with their stress during their cancer journey. This study included quasi randomized controlled trials of art therapy as a convalescence effort. To analyze the caliber of the study, researchers used the JADA scoring system was implemented. Results yielded anxiety, N equals 4, QOL N equals 5, depression, mood states, blood pressure, heartbeat, amongst other things. Commendations for art therapy to be offered to breast cancer patients was highly rated since the art therapy in this study improved depression and coping mechanisms. Another evidence-based practice was done in 2018, a multiple case study on women that were infertile and diagnosed with depression. The basis of the study was a mixed method that implemented 13 partakers who participated in 6 art therapy classes. To rate depression prior to doing the art therapy class and after, researchers used the Beck Depression Inventory, participants experienced a statistically significant decrease in depression from the pre-intervention mean score of 20.5 to their post-intervention score of 10.8. Becoming an art therapist. What kind of education do I need to become an art therapist? A master's degree is necessary for entry-level practice in art therapy. The educational standards require graduate-level coursework that includes training in the creative process, psychological development, group therapy, art therapy assessment, psychodiagnostics, research methods, and multicultural diversity competence. Students must also complete a minimum of 100 hours supervised practicum and 600 hours of supervised art therapy clinical internship. In addition, preparatory training in studio, art, drawing, painting, clay, etc., and foundational areas of study in psychology are required in advanced graduate studies. The art therapy graduate curriculum is uniquely guided by the premise that focused art therapy constitutes reflective practices and facilitates learning. Where can I find a master's level art therapy program where I live? There are master's level art therapy programs located, excuse me, across the United States and in Canada. How do I know if an education program is a quality program? High quality art therapy programs prepare their students for entry level skills and postgraduate certification as an art therapist. Quality programs also undergo a rigorous annual review process by which ensures their resources, curriculum, faculty, and policies are prepared to meet your learning needs. A period of transition in regards to these review processes is currently under the way for art therapy programs. Educational standards, which have been established by the American Art Therapy Association, are transitioning to begin managed by the Accreditation Council for Art Therapy Education, which is overseen by the Commission of Accreditation of Allied Health Education at the same time. In conclusion, art therapy is a productive and beneficial mechanism of coping that has helped many people since it first evolved. Those that participate feel a sense of being able to find themselves at the very same time while losing themselves into the specific type of therapy. This form of therapy takes the focus off the patient having to specifically divulge intimate personal details, yet allows them to transfer them into a picture. Nearly 16.2 million people have depression. This includes only those who have been diagnosed. Not many people are aware of the various types of therapy. Most are familiar with sitting and conversing with a counselor of mental health profession, which some people find intimidating. The Ontario Art Therapy Association states that art therapy provides assistance in resolving emotional conflict, raising self-esteem and self-awareness, changing behavior, developing coping skills, and for problem-solving strategies. Art helps with the healing process across all lifespan. Barasa stated art therapy is an intervention meant to assist clients express themselves when they otherwise are unable to do so, and it can significantly improve clients' mood, decrease their levels of stress, anxiety, and assist in better communicating for the self and their individual situation. And that concludes my presentation on art therapy. Study guide. Art therapists are professionals trained in both art and therapy. Art therapy shifts its focus on your inner experience. Art therapy is the therapeutic use of art making guided within a professional relationship and environment by people who experience illnesses, trauma, or challenges in living, and by people who seek personal development. Art therapy is beneficial to anyone, including children. No previous art classes or training are needed. Art therapy can be separated into two categories, art therapy and art psychotherapy. Examples of art therapy are drawing, coloring, painting, doodling, sculpting are all examples of art forms that can be used as a means of therapy. The main goal of focus for art therapy is self expression. The environment is friendly,